A warm good morning to one and all present here. My respect to chairperson and other delegates. I'm here to present my topic on effectiveness of nurse-led caregiver empowerment program on stress, coping, and quality of life among caregivers of patients with schizophrenia admitted in selected tertiary care hospital, Chennai. So schizophrenia is a mental disorder which affects approximately 24 million. So that is 1 in 300 people worldwide. This report according to the World Health Organization in the year 2019. So Guru Raj in the year 2022 have identified National Mental Health Survey of India conducted in the NIMHANS, which is National Institute of Mental Health and Neurosurgery. They have estimated the prevalence of schizophrenia is about 0.3% to 0.5%, which is also similar to the previous surveys which they have conducted. The incidence of schizophrenia in India is follows as the current prevalence rate is 0.41%, as it goes lifetime prevalence is about 1.4%. The lifetime prevalence of schizophrenia is relatively higher in the age group of 40 to 49 years of the age group, which is constitute 1.61%. So this report was given by Hedge in the year 2023. So schizophrenia is indeed a disruptive and distressing illness for both those affected and their families. So nearly 32% of the patients with schizophrenia support themselves financially, 36% by spouse, and 17% by their parents. So managing schizophrenia requires a significant investment in terms of time, energy, and financial resources for both individual and their families. So this following information depicts about 50% of the caregivers have to spend 6 hours per day in taking care of the patient who are having a schizophrenia. And about 37.2% of the caregiver have to spend 6 to 12 hours per day in taking care of the schizophrenic patients. So this was the report given by the Hajbi in the year 2019. So why this need arises here? Because the need for the formal care and the burden upon the healthcare system has to be reduced. And that burden goes to because of the deinstitutionalization, which is the shifting of care from the institution to the care is the motto of the mental health care. Okay, so where the burden goes automatically to the caregiver and where the caregiver have to take a multidimensional role there. So caregivers of patients with schizophrenia often face significant challenges, which including lack of awareness about their roles and the functions. And they also experience family conflict, stigma, isolation, emotional frustration, burnout, because the patient's unpredictable and bizarre behavior may increase pressure over a caregiver, and that gives stress and leads to the poor quality of life. And they also experience significant stressors and the burden, like they'll have a physical discomfort, disturbed routine habits, they have a tension, violence, chronic sorrow, financial difficulties, they have their own role changes and social withdrawal, and also they'll also have a lack of resources and the support. So the chronic nature of the schizophrenia can indeed lead to a significant distress and feelings of hopelessness among caregivers, since the caregivers play a vital role in the treatment of the patient with schizophrenia. So they're named as high-risk group for the mental health disorders. So in this study, the investigator has opportunity to engage extensively with the caregivers through a nurse-led empowerment program, which address the various aspects of their caregiving role. So this initiative aims to reduce caregiver stress, enhance coping skills, and ultimately improve their quality of life. So by implementing a formal support program, caregiver burden can be alleviated and leading to better emotional well-being and overall life satisfaction. So with this, the aim of the study goes to evaluate the effectiveness of nurse-led caregiver empowerment program on stress, coping, and quality of life among caregivers of patients with schizophrenia. So the objective of the study were to assess the level of stress and coping and quality of life among caregivers of patients with schizophrenia and evaluate the effectiveness of nurse-led caregiver empowerment program and associate the stress, coping, and quality of life with selected background variable among caregivers of patients with schizophrenia in both study and control group. So these are the operational definitions. So the nurse-led empowerment program intervention consists of 3 sessions. Okay, the session 1 will start from the day 2, because the day 1, the introduction and all pre-test and all these completing. So where the individuals or the caregivers were allowed to share their emotional concerns about their patient and the self. And the day 2, So they were given the psychoeducation, which include meaning, causes, signs, and the symptoms, treatment, and the day 3, following management and relapse prevention. And session 2, the coping strategies were taught to the patient, where we had an interactive session through the PowerPoint by lecture gum discussion by the investigator. And the session 3 includes the caregivers were taught about a simple relaxation technique, which include deep breathing exercises, where the demonstration and written demonstrations were done. Okay, so each group, there are 4 to 5 caregivers. For about 45 to 60 minutes, the interventions were given to the patient. These are the operational definitions used by the investigator. So the hypothesis which the investigator formulated here, the caregiver of patient with schizophrenia who is receiving nurse-led caregiver empowerment program will have reduction in the stress level, will have a positive coping abilities, and will have improved quality of life. And these are my delimitations. The current study is delimited to the caregivers of patient with schizophrenia who was residing with the patient in the psychiatric ward and attending the follow-up visit to the psychiatric outpatient department. So the caregiver of patient diagnosed with schizophrenia according to the international classification of disorders, and caregivers of patient with schizophrenia who plan to continue the treatment at Sri Ramachandra Hospital, Chennai. The assumptions, the caregivers of patients with schizophrenia often experience reduced quality of life. An extended period of caregiving can lead to stress, resulting in inadequate coping mechanism for the caregivers. A nurse-led caregiver empowerment program can help reduce caregiver stress and improve coping skills and enhancing their overall quality of life. So these were the reviews being collected by the investigator based on the stress, coping, quality of life, and effectiveness of nurse-led caregiver empowerment program on stress, coping, and quality of life. And the modified conceptual framework based on the Betty-Newman system model was adopted by the investigator. And the true experimental research design with randomization was done for the this study. So where the group control and the study group, on the day 1, the pretest was done. On the day 2 to day 6, the intervention was given to a patient. And post-test was conducted on the 30th day. And reinforcement 1 was given on the 45th day, and post-test 2 was conducted on 60th day, and reinforcement 2 was given on 75th day, and post-test 3 was conducted on 90th day. And research design, setting of the study, both psychiatric ward and outpatient department and Sri Ramachandra Hospital, Porur was selected, and target population of the study comprised of all the caregivers of patients with schizophrenia, and accessible population includes caregivers who are caring their patients in the psychiatric ward and outpatient of Sri Ramachandra Hospital. The sample consists of caregivers of patients with schizophrenia who fulfill the inclusion criteria during the study period. So sample size was calculated based on the study, previous study done by the Chu in the year 2011. And where the alpha error, the 5% of the alpha error was considered, and derived 150 samples, where study group carries 70. Considering the attritions, so we have concluded 75 in each group. And this is a flow of participants recruitment. So finally, we have analyzed after considering the attritions. In the study group, we had 3 attrition. That may be because of, that's because of shifting of the residents, and married and irregular follow-up. We lost 3. And finally, we analyzed 72 in a study group. In the control group, changed the hospital. They've separated, irregular follow-up, and 1 expired. So finally analyzed 71 in the control group. So the criteria for the sample selection, in inclusion criteria, the caregivers of patients with schizophrenia who are above 21 years, those who are available during data collection period, were able to read and write English or Tamil, willing to participate in the study, male or female, not on medical treatment for any other chronic illnesses, and carrying their patient for more than 6 months. And then exclusion criteria, and caregiver who are not a family member of patient with schizophrenia, and caregivers of patients with comorbid psychiatric disorders were excluded, and who are practicing yoga or meditation were also excluded, and the caregiver who were having an hearing impairment were excluded in this study. So tool description, tool has 2 parts, part 1 background variables, and part 2 consists of perceived stress scale, coping checklist, quality of life. And part 1 background variable consists of age, gender, residence, education, religion, occupation, type of family, marital status, family income, medical expenses, and relationship with the patient, and duration of the illness. In part 2, the perceived stress scale, Cohen et al. 1983, 14 items perceived stress scale were used. And the score were interpreted as 0 to 18 low stress, 19 to 37 moderate stress, and 38 to 56 high perceived stress. And part 2 coping checklist, Kiran Rao and Prabhu, 70 items, dichotomous SR no questionnaire were used for this a coping checklist, which has got 7 subscale, like a problem-focused coping, emotional-focused coping, and problem and emotion-focused coping. So the score interpretation, higher the score, better coping. And the quality of life, WHO quality of life BREF scale was used for this study, and having a 4 domains: physical, psychological, social, and the environmental domain. The maximum score indicated the higher quality of life. This is a data collection procedure which is adopted by the investigator. And descriptive and inferential statistics were used to analyze the data. And the distribution of the background variable. This table 1 depicts the distribution of the background variable among caregivers of patients with schizophrenia and the study and the control group. In study group, the majority of the caregivers belongs to the 31 to 40, and same goes to the control group. And in the residents, when both the study and the control group, the caregivers were from the urban resident. And considering the gender of the caregiver in the study group, 81% of the caregivers were female in both the groups. Female were the caregivers. And the education, majority in the study and the control group had their secondary level of education. And in the religion, most of them and both groups belongs to Hindu. And occupation, if a female, so they were the homemaker in the both groups. And type of family, in majority, they were from the nuclear family. Considering the income of the caregivers, so majority in both the study and the control group were between the 20 to 40,000 per month. And considering the medical expenses in both the study and the control group, so the expenses were paid by the self. Relationship with the patient, so majority in the study and the control group were parents. And duration, so both groups are having a more than 6 months to 1 year of the duration of the illness. So this table 2 depicts about the level of stress among the caregivers of patients with schizophrenia, and study and the control group state that there is a decline in the stress level from the pre-test to the post-test 1 and post-test 2 and post-test 3 in the study group. And whereas in the control group, there was the reduction in the post-test 3, the stress, that maybe because of the other reasons they might have taken other measures to reduce their stress, which not control of the investigator. And coming to the comparison of the pre-test and the post-test mean and standard deviation of the stress. So from the post-test 2 and post-test 3 had a significant difference was found in the study group, and same in the control group. Coming to the repeated measures of ANOVA on stress. So within the group and between the group, there was a significant difference was found. So hence the hypothesis accepted here. And post-hoc Bonaferi post-hoc test was also determined to find the differences in the stress score between all the points of the time. So post-test 2, post-test 3, and post-test 2 and 3, and post-test 2 and 3, post-test 1 and post-test 3, there was a significant difference was found in the study group. So hence this hypothesis was accepted. So discussion on the stress. So there is a statistical significant difference in the stress among caregivers in the study and the control group at post-test 1, 2 and post-test 3 at the p less than 0.05 was identified here. And the same, this result substantiated based on these two researchers. Table 6 depicts the comparison of the pre-test and post-test mean and the standard deviation of the coping. So there was a significant difference was found in the pre-test and the post-test 1 in the study group, and there was no significant difference found in the control group. So coming to the comparison of the pre-test, post-test mean and the standard deviation of the coping scores among the caregivers of the patient. So based on the sub-themes, the problem-focused pre-test to post-test 3, there was a significant difference, and emotional-focused and problem and emotional focus had a significant difference in the pre-test to the post-test 3. And the comparison of the pre-test post-test test mean and standard deviation of the coping among caregivers of patients with schizophrenia between the study and the control group. So there is a significant difference was found in the post-test 2 and post-test 3 between the mean difference was found here. The repeated measures, there was a significant difference within the group and between the group found in the study group. And post-hoc test determine the differences here. There is a significant difference was found between the post-test to post-test 1 to post-test 2 and post-test 1 to post-test 3 was found a significant differences. So hence this hypothesis also accepted here. So there was a statistical significant mean difference in scoping scores as the post-test 2 and post-test 3 found between the study group and the control group, and these results substantiated the same. And the table 11, comparison of the pre-test and post-test mean and standard deviation of the overall quality of life scores shows here. From the pre-test to post-test 1, post-test 2 and post-test 3, there was a significant difference was found in the both the groups. And this is the comparison of the domains of the quality of life. So there was a significant difference was found in the physical health, psychological health, social relationship and the environment among the both the study and the control groups. And repeated measures of ANOVA quality of life, there was a significant difference found within the group and between the group. And hence this hypothesis also accepted. So the post-hoc, there was a significant difference was found to the pre-test to post-test 1, post-test 2, 3, and 1 to 2, post-test 1 and post-test 3 was significantly associated here in the study group. So discussion. There is a statistical significant difference noted in the mean scores of the quality of life in all the domains at p less than 0.05 between pre-test and post-test among caregivers of patients with schizophrenia in the study group. So the last objective of the association of the stress coping and the quality of life with the selected background variable. So there was a significant association was found between coping with the education, occupation, relationship, with the patient among the caregivers in the study group, quality of life with the social support among caregivers in the study group, stress with education among caregivers in the control group. The implication, so based on the nursing practice, nursing education, so nursing practice where the nurse can plan individualized caregiver casework and care plans can be done it here. The nursing education, exclusive elective courses can be conducted for a student who are studying psychiatric nursing. And nursing administration, so nurse-led psychoeducation clinics can be initiated in the psychiatric OPDs to help the caregivers to have a better understanding. And the strength of the study paves the way to run an independent nurse-led psychoeducation clinic at Sri Ramachandra Hospital. The sample size is 150, is larger than majority of the trials that have been conducted in the various experts. The intervention and dependent variables are unique. The outcome variables were assessed for 3 months, hence the study allowed the sufficient time for the caregiver to practice the strategies taught by the investigators. So the limitation of the study was conducted only in one setting, so lack of long-term follow-up is yet another limitation. The practices were monitored through diary by the investigator. Only the given answers was considered and accepted. So investigator had no control on the schizophrenia stress management related information received by the participants from other sources. This might have influenced the outcome variable, but it was beyond the nature of the study. So apart from background variable, researcher could have assessed with the patient-related variables while contributing caregiver stress like readmissions, relapse symptoms, and the medication adherence. So recommendation, a similar study can be conducted as a multicentric with a larger sample size. Comparison can be done in 2 different settings. Studies may be replicated in other settings, especially in the community areas, and long-term follow-up studies for a period of 1 year can be conducted. To conclude, the current study concludes that the nurse-led caregiver empowerment program is effective in reducing stress, promoting adequate coping, and improving the quality of life among caregivers of patients with schizophrenia. In addition to the nurse-led empowerment program, reinforcement and proper follow-up are essential in preventing relapse and improving the disease management. Thank you.